I'm biased because I'm a pediatrician, but I really feel like we all go into this with the patient first concept. We want to help people, and for those of us that go into pediatrics, we love children and we want to take care of them and make sure they're safe and healthy throughout their life. And so, you know, I think what's important to that is that building of a relationship and trust over time. That's what I think most of us just love about our jobs, is to be able to take an infant and watch them grow and develop through their teen years and be a part of that and be helpful for the family in that regard. So, you know, I mean, this is a sad thing when a person that misuses a trustful situation and really breaks trust for families, but I sure don't feel that is what we would expect or think is the norm. You know, physicians are guided by principles that are to help and take care of and be professional and respectful of patients and families. You know, we see them from birth to up to 18 or maybe even a little bit older, and so every visit is different. Parents are critical to every piece of that. Of course, as kids are younger, parents are always going to be in the room. Kids are going to be very uncomfortable if they're not, and we utilize parents as a huge support during the history as well as the physical exam. It really lets the kid know over time, kind of establishing that trust that we have as the parent, the child, and the provider, getting to kind of know us as a group, so that as they do get older, start to have a little bit more relationship with my patient. So the family is still very much a part of my patient's situation, but ultimately as they get older, that patient, the child, becomes my focus. Parents are still critical in terms of getting history and being support for their kids. However, as kids get older, they do seem to want more privacy, especially sometimes with exams, and with some time to talk about more private, sensitive matters. It's really important to provide a confidential visit at some point during the visit with teenagers. And so, you know, that may be where a physician or provider might ask a parent to leave, and it gives us some time to chat with the teenager about whatever it is going on in their life. It's important for the provider to explain what that's about, why we're doing that, what might happen during those times, including potentially the physical exam. A lot of teenagers are fairly private, and they may not want a parent in during that time. If the provider explains exactly what's going to happen, and the parent or the teenager may feel uncomfortable with that, they have every right to ask for a chaperone during that time, and a provider should be very willing to accommodate that request. We just want patients to feel comfortable. We want parents to feel comfortable with what's going on. But sometimes that confidential time with a teen can be very critical to kind of getting out and discussing the needs that they're facing at that time. If they're not comfortable with it just being me and them, then offer that chaperone to come in so that there's someone else in that realm. Maybe it's that I'm an opposite sex provider and they would feel more comfortable with a same-sex provider to be doing sensitive parts of the exam, say the genital exam. I have on numerous occasions asked, would you be more comfortable with a same-sex provider? And again, just really trying to explore what is their uncomfort, what are their questions and concerns, and really trying to react to that and make sure that they are comfortable during that time. So there's essentially two types of exams that we do. One is where kind of the standard physical, where the family comes in, they bring their kid in for a sports physical or a well child check or just a physical general medical exam. That will entail kind of a head-to-toe exam, including sensitive parts of the exam, such as the chest area and genital area. Again, these are fairly brief. They're really just looking at making sure everything looks healthy and the anatomy is normal. There's no concerns that we see. The other type of exam is going to be a focused exam where, say, a child comes in with a complaint in a certain area. And if that complaint involves the genital area, then it may be a little bit more of a focused exam to that part of the body. You know, I don't want a patient to feel uncomfortable with me, and if it's just because our personalities don't clash or whatever it may be, I don't really doesn't bother me the reason. If they're uncomfortable, then they either need to talk with me about what's uncomfortable or decide to change providers. You know, we should respect families' wishes on that part. you know, our whole goal is to make people comfortable in the relationship, and if it's not, then they need to change. An example that I see a lot is female patients that grow up kind of with a male physician, and up until a certain point, that works pretty well. And a lot of my male colleagues, usually around the age of 11 or 12, may start to say, hey, as you're getting older, if you would feel more comfortable with a female physician, feel free to look into that. Here's some names of my colleagues that see a lot of girls. If you want to stay with me, I'm happy to do that too. But again, here's some options for you because we want you to feel comfortable. And I do the same for my male patients, because I know that it gets more sensitive as they get older. And I guess I just want them to know that I'm very open to talking about that, and just really open to hearing what they have to say, and just whatever makes them comfortable. And it's interesting what they say. I mean, some of them will say, well, you've been my doctor for 10 years, why would I switch to somebody new? So everybody's different. Everybody's different in what makes them comfortable, and I guess as the provider, I just want to make sure they know I'm willing to do whatever it takes to make them comfortable in that interaction.